GBS, as we are talking about it right now, has long existed in our community. And what makes it a bit more of a concern now is that there is a variant of a bacteria that causes the immune system to react too much. You never have any control on the occurrence, incidence, or how the GBS is going to manifest in you. As common as a common cold can also precipitate GBS. So there is no way we can know a person is prone to GBS. It can happen to you or me. GBS can present with the classical symptoms, sometimes very vague symptoms, where it starts with weakness in using your limbs. Like you may start having difficulty in getting out of a chair all of a sudden, and you may start having buckling of your knees all of a sudden, and you may drag as you walk. Probably a day or two you may start feeling that you may not be able to mix your food or not able to lift your arms. And in a few people it may start reverse. It will start with the mouth. They'll start having, like whom I saw yesterday, it may have a facial weakness. They will have swallowing difficulty, and they will have a change in the voice, and then it may descend down, but that's not a very common one. It's a rare variant.
The Guillain-Barré Syndrome or GBS has claimed 5 lives in Andhra Pradesh between January and February of 2025. The state's health minister Satyakumar Yadav has also reported that from November 2024, more than 45 cases of GBS have been reported in the state. Meanwhile, neighbouring Maharashtra has also reported 17 to 18 GBS-related deaths between January and February of 2025. What is GBS? Is it a cause for concern? To find out, we're joined by Dr. Venkatraman Karthikeyan today, a neurologist with the Kauvery group of hospitals in Chennai. But before I go across to Dr. Venkatraman, I would like to remind our viewers that the News Minute is an ad-free platform. We are not dependent on government or corporate advertisements. We are dependent on you. Become a paid subscriber today. So, sir, tell us, is GBS a cause for concern? That's the first question I have for you.
GBS, as we are talking about it right now, has long existed in our community. It's something that a neurologist doesn't get surprised, because it's something that happens with every infective endemic. Like during the winter periods, you get these pneumonia, you get the common flu, sometimes even the diarrheal episodes that happen. And we do expect the GBS to follow suit when such things happen in the community. And we know from our information that, okay, there's been some respiratory tract infection going on in the community. Expect a GBS in the next 2 weeks. So it is something that has been there in the community. And what makes it a bit more of a concern now is that there is a variant of a bacteria that causes the immune system to react too much. And that is why the cases are probably clustering a lot. But on a general note, you need not panic or you need not get so much concerned about it, because you never have any control on the occurrence, incidence, or how the GBS is going to manifest in you.
So, what is GBS for a common person to understand? How can we understand this disease?
So, I'm going to say you a simple basic. When we take the nervous system, it is broadly 2 types. It's like we have a central government and a state government. So is the nervous system divided as a central nervous system and a peripheral nervous system. So all those nerves which leave out of the spinal cord and all those nerves which leave out of the brain, they come in this peripheral nervous system. Now, these nerves have a structure that is made up of proteins, fats, and carbohydrates. Of these, there are certain proteins which gets identified by our own immune system as something foreign. Now, how does this happen? So, in most instances, there could have been an infection in your body preceding this GBS a couple of weeks ago or 10 days back. People might have had a diarrheal episode. People might have had these respiratory infections. So the virus or a bacteria enters your system, and the first response of your body is to send your immune system to kill those bacteria and virus and exit them out of the body. Now, when these immune system have gone there, they have become active. They are now into the action. And suddenly, to their eyes, the proteins in the nerves also look alike the proteins of the bacteria or virus. And this we call as a molecular mimicry. We know that the mimicry agents, actors mimic the actors, right? So similarly, the molecular mimicry makes the immune system think wrongly that your nervous system is a virus, is a bacteria. For them, it works as a code or signal. So they don't stop, they just go and hit the nerve. And when they hit these nerves, whatever these nerves are doing, whatever function these nerves are doing, they get jeopardized, leading to numbness or weakness. And since it happens in a rush, it happens in a massive way, it causes a severe, rapidly ascending weakness of a severe nature called the GBS.
Okay. And from what I understand, from whatever you explained right now, it doesn't seem to be something that's contagious or something that can be hereditary. Am I assuming right?
Yes, so this is just a reaction of an immune system to an infection, which is something not in your control. And the infection need not be a dreadful infection also. As common as a common cold can also precipitate GBS. So there is no way we can know a person is prone to GBS. It can happen to you or me. And we have gone through all these infections in our life without even knowing that we may even get a GBS in one of these infections.
Right.
So it is nothing that is contagious. It is not handed over generations to the family members.
And because you're mentioning that it can occur to anyone, and we're suddenly seeing so many cases being reported, how common is GBS? Because I personally have not heard of this infection in recent years, and suddenly we're seeing an increase in the number of such infections. So, how common is GBS?
As I said to you when we started, every year in the months of November and December, especially in a place like Chennai, we expect GBS. So the neurologists who have been practicing for years know that in these months, the incidence of GBS is high. But then compared to most of the neurological disorders, this is not very common. The proper incidences and prevalence may not be known well, as the knowledge of this to a common man is right now happening. And since the media's interest in this has grown, I think the governments have also taken note on the incidence and prevalence very much on this particular issue. Otherwise, it's not a disease which government needs to monitor previously, because it is a very rare occurrence.
Right.
And this is something which is well known in the months of winter, where the infection is high in our community.
In Andhra, for instance, they've said that it didn't occur in any sort of clusters. They've randomly, in different, taluks, in different districts, they've come across GBS cases. But in Maharashtra, they said that in Pune especially, they found clusters in this infection, and they connected it to a bacterial infection. So is it that that particular bacterial infection can cause more GBS, or is there any sort of understanding that we have, or is it that it just happened to a cluster? How do we understand that phenomenon?
Across all the studies in the world, especially a bacteria called the Campylobacter jejuni, which is known to cause the gastrointestinal symptoms of diarrhea and vomiting, has been the most related organism to a GBS.
Okay.
And I presume that could be the organism that is causing the wave there. And that is something that can be seen. It's a water contaminant. Probably that needs to be taken care by the local authorities to do with the water hygiene and other stuff. So it is a cluster because the same water has been contaminated to the group of people there, and probably that could be the reason of it. Or it's also hand-borne and it is like contaminated over food. We really don't know, but then it can happen in clusters because the infection is the same for the people who got affected. And the occurrence of GBS is sometimes also related to the immunogenicity of the organism. I'll take you back to this COVID. When COVID came, COVID is nothing but another respiratory virus, like a flu virus. It became such a panic and it became such a pandemic issue because COVID invited the immune system more than any
Other
other
infections.
flu virus, like more than the swine flu, more than the H1N1. So it resulted in the immune system going and killing the virus, not only virus but also the lung, thereby leading to lots of mortality. And similarly, lots of infection come and they may trigger immunogenicity. However, when the immune system is taken over like a flood, the invitation is so high, then they result in the damage of the organ where they are going to do in a massive scale, leading to such higher grades of GBS.
So, from what I understand, it cannot be prevented? Is that what you're also saying? Because you said it can happen to anyone. Is there any way we can prevent GBS from
Only way to
occurring?
prevent is being hygienic. Wash your hands, healthy food, good drinking water, and wear a mask especially in the winter periods where the atmospheric whatever we call is denser, the cold is very dense, and then the infections are not able to move out. It's all there, and it's going to affect you.
So, is it airborne
No,
GBS?
GBS
Because
cannot be airborne.
you're
GBS
talking about the other flu infections
organisms, the
that one can
organisms,
develop.
the infections that are going to happen. There are only few ways you get an infection. It's either the respiration or your oral route, which is either be a water contamination or a food contamination, or through the skin. These are the ways you'll have to prevent them. That's it.
And what is the course of treatment if someone's diagnosed with GBS? What is the treatment like? How are they actually? How do you find out that a person has been affected by GBS? What kind of tests are done? And then what is the course of treatment for them?
So GBS. Let me tell you a patient whom I saw yesterday. She just comes with a symptom of weakness of the right side of her face. The her left side just moves to the, it just gets pulled, and the right side is weak. On a general note, we call this a Bell's palsy. But I also found her walking like a drunkard, right? This and this are not related. So immediate thought is a evolving GBS. Now, why I have to say this is Guillain-Barré syndrome is a highly clinical condition, and diagnosis is generally made on clinical examination. Waiting for an investigation to give your diagnosis may delay the diagnosis. So it's decided by the neurologist in the clinic, and the earlier we act upon it, the faster we recover or we prevent the damage much. Now, there are few tests where we examine the muscle power. We test what we call the reflexes of your limbs. And when the reflexes are gone, we immediately come to a conclusion that the person is having a Guillain-Barré syndrome. Now, once we have this diagnosis, we sometimes don't even wait for any investigations, or rather, we rule out other causes before calling it a GBS. In the case we do a spine MRI, it could be something to do with the spinal cord or the brain. As I told you before, this will not affect the central nervous system. So we'll try to rule out anything that is in the spinal cord or the brain. And if it's not there, we start treating. In rare cases where GBS is not very rapid, it's not ascending, patients are still walking. Like I said, the person yesterday was walking, although with a swaying. Those cases, sometimes we could give some time and we do the test called the nerve conduction study, where we electrically stimulate the nerve, see whether the nerve impulses were from the point of stimulation to the electrode where we place go in a good time and go with a good amplitude. And with GBS, start with 5 days from the symptom onset, these will be impaired or disrupted. And that gives you the second clue. Rarely, we also do the lumbar puncture, which is we put a needle in the back of your spine. We try to tap out a fluid from your spine and send it for analysis, where we get in GBS, we may have an elevated protein level, which is not normally seen as a marker of inflammation into your spine, away outside your spinal cord where the nerves exit, causing these symptoms.
Okay.
At this point, once we have decided, then the approved treatment for GBS are two options. One is an IV immunoglobulin, the other one is the plasma exchange. Now, with the IV immunoglobulin, it's nothing but taking out the blood from healthy volunteers, filtering out the antibodies, normal antibodies from them, taking it as an extract, and then filtering out all the viral particles, everything, and it goes into a bottle like our normal saline bottle, and that's a condensed concentrated version of antibodies. Now these antibodies are just administered as a infusion. Once they enter your body, they will go identify those corrupted antibodies and neutralize them,
Okay.
and they give the nerve time to recover. So just giving these IVIG won't recover you miraculously. It will only stop the slope. It will slow down the slope. If the slope is going up, it will just make it blunt. The plateau will happen, and then you'll start to recover. And the other option is a plasma exchange, because IV immunoglobulin comes with its own cost. Plasma exchange is something which can be affordable, and it can be readily done even in a medical college, where it is like kind of similar to a dialysis, where we remove your blood, send it to a machine, filter out the plasma, which is an extract of all these antibodies, take it out, infuse new plasma, which is from a healthy volunteer, thereby do the same job of a IVIG.
And in both these methods, how long does it take one to recover?
Okay. So when we call GBS, we also have to know what is the scientific name of it. This GBS is something which was given based on the names of these people who first wrote about it, Guillain and Barré. Now, what is the scientific name to it? It's called the acute inflammatory polyradiculoneuropathy. So doesn't need much explanation on acute and inflammatory. Poly means multiple. Radicals, it means the nerve roots. So radical and nerves are getting damaged. So that's what it is. So anything that is acute is less than 4 weeks. More than 4 weeks, it just converts itself into a different name called this subacute inflammatory polyradiculoneuropathy. And anything more than 8 weeks becomes a chronic inflammatory polyradiculoneuropathy. So when we are focused only on the GBS, we are talking anything less than 4 weeks. So the ascent of the weakness or worsening or the neurological symptoms generally peaks at 2 weeks, plateaus by next 2 weeks, and then you start to improve in the coming weeks. However, when we stop this ascent, like probably I picked up this person yesterday in couple of days. When we stop this ascent by giving these treatments, we may even make the plateau happen in 1 week, and the plateau will be in 1 week, and you'll be recovering in the next couple of weeks, whereby you can even improve in a month. There have been certain conditions where the GBS comes very disastrously, leading on to severe weakness not only of the limbs but also the respiratory muscles, and thereby leading to them getting into the intubation and ventilation artificially. So in these conditions, the recovery may take longer, somewhere between 1 to 3 months, and in some of these patients the recovery not be complete. There may be a partial recovery where they may have to live with one of the limbs having weakness, or some part of the limbs having weakness.
And when you're talking about all of this, you said that in some patients it may take 3 months. So even if they fully recover, is there a chance for GBS to reoccur in a person after, say, another infection in a few years down the line? And how intense does it get then? Is it still the same kind of recovery, or does it get difficult for the recovery to happen at the same speed, or say at the same level?
Okay. So on a general logic, there is no reason why one should not get another GBS. Your immune system can It doesn't, we really don't know. We must have had 100 infections in our life, and we don't know on only why this infection only had created a GBS. You must have had the cough and cold many times, but maybe the last cough and cold precipitated a GBS. So there is also no reason why we should believe that it should happen only once. However, on practical terms, we never see, or we rarely see, recurrences of GBS in a person. For what reason, we don't know. But if you ask me, have you seen? Yes, we have seen. And if they had responded well in the previous terms, they do respond well to the successive GBS occurrence also.
Okay.
The key here is to identify it as early as possible.
When you speak of early diagnosis, what are the kind of symptoms that one should look out for and immediately consult, a doctor when it comes to GBS?
So GBS can present with the classical symptoms, sometimes very vague symptoms. For a few people, well, we'll start with the classical symptoms. Most the textbook described ones, or the most common ones, are the ascending paralysis, where it starts with weakness in using your limbs. Like you may start having difficulty in getting out of a chair all of a sudden, and you may start having buckling of your knees all of a sudden, and you may drag as you walk, which you may find odd. You would have thought that, okay, I sat on the toilet for some time, that's why this is happening. All those things will happen, and in a probably a day or two, you may start feeling that you may not be able to mix your food or not able to lift your arms. So that's how it starts to ascend, and you'll be seeing yourself unable to turn in the bed or get out of the bed. So this ascent itself is a very classical picture, is how the GBS starts. And in a few people, it may start reverse. It will start with the mouth. They'll start having, like whom I saw yesterday, it may have a facial weakness. They will have swallowing difficulty, and they will have a change in the voice, and then it may descend on, but that's not a very common one. It's a rare variant. And these are the symptoms where you feel that this is happening on first day. You will be seeing like this in the same day also. We have seen for a few patients, within hours they go from zero, from 100 to 0, like that. They'll be functioning, and then morning they would have been having struggling in walking. Evening they are completely the muscles don't move in your limbs. They are paralyzed. So that ascent can be rapid or can give you few days, but it will most likely ascend. And for some people, there will be the vague symptoms where they'll have severe pain in the back, full back spine preceding these symptoms. They'll be going to orthopedicians, getting treatment at that point of time. But if you clearly ask them history, at that point itself, they would have been having difficulties in getting up from a seat. They would have caught and they would have thought that this is the pain that is causing this. And these are how it presents. And the danger comes when it involves your swallowing muscles and breathing muscles. That's where we'll have to get into the action really fast, no waiting for any investigations.
Likewise, when you say that it's sudden, there's a sudden ascent in like your symptoms. Is it still easy for someone to make recovery when that quickly GBS attacks them, or does that put them at some risk?
Yeah. So the recovery of GBS is not something that we see related to the rapidity of its symptoms. It may be rapid, it may be slow, that doesn't matter. The recovery depends on certain factors, which includes the involvement of your swallowing muscles, your breathing muscles, and what type of person you are. If you're a person who's having a very bad sugar, uncontrolled, obese, morbidly obese person, your recovery can be difficult. And what type of GBS? So when we talk about GBS, on the study that we do in the nerves, the electrical study, it is broadly into two types. The one which is called the demyelinating GBS, where if you consider your nerve as an electric wire has fibers inside and a plastic sheath outside. Now the GBS is like you can hit only the plastic sheath, leave the fibers intact. or you can also hit the fibers also. In general, the ones which are hitting the plastic sheath do recover on a good sense. The ones which are hitting the fibers, but only the fibers which are supplying the muscles, also do recover, especially in the children. However, the ones which hit both the nerve fibers which supply the muscles and also the sensation, they recover poorly. So these are some of the factors. Basic factor is what symptom it produces rather than how rapid it is.
And what the final question to you would be, what makes it fatal? Because suddenly we are seeing so many fatalities. Is it late diagnosis, or what can we attribute this sudden increase in the number of deaths to?
Yeah, as you rightly put, sometimes it goes missed and you may reach the hospital late, or very rarely the suspicion may not be great because the one who's handling this may not have been exposed well to diagnosing GBS. As I rightly put, it's a clinical diagnosis. You don't have time to investigate. You'll have to just, with your experience and expertise, need to act on it fast. Yes, these are factors, and sometimes this is as I said you, if it ascends fast to involve the the swallowing and respiratory muscles, these are people who may not come out of the ventilator. They may even sometimes succumb to the ventilator related infections, and these are people who may also have these other factors, the comorbidities, poorly nourished children, malnourished children. These are people who don't do well. An healthy male or a female, even though they are into the ventilator, do come out in most instances. Now the patient attributable factors are also there. So these are and sometimes there is also part of GBS where it hits the nerves which supply the heart, control the heart rate and blood pressure. In these patients, because the nerves that acts as sensors to the blood pressure are gone, heart just rapidly beats 150 on a minute and then it goes to 40 a minute. And they may also succumb to a cardiac arrest. And these are the only conditions. We don't have any control on these, except for giving the medicines, supporting them with ventilator if it is needed, and waiting for the recovery. On one such instances, especially during the COVID, where I had a patient who came gasping. And at that point of time, we were finding it hard to find beds for COVID. Just that I suspected a GBS, she had a admission inside. Otherwise, with the COVID on, people were not getting beds. We almost lost her. She was unconscious because she was gasping, because she was not able to get her oxygen due to complete paralysis. We admitted, treat her, and she got discharged. She joined back as an headmistress, and she's working. So even the bad cases have come out well.
So it all depends on the diagnosis at the right
time. And the right time of treatment.
Right. Thank you so much, sir, for telling us so much about the disease.
Thank you.
If you found this video helpful, become a subscriber of the News Minute. You can do so by clicking on the QR that is on your screen.